Bismillahirrahmanirrahim. Assalamu alaikum. So today we are going to study about the tricyclic antidepressants or TCAs. In the previous lecture we have already discussed about the depression, what is depression, what is the pathogenesis behind the depression, and the classification of antidepressant drugs in detail. In this lecture we are studying specifically about the tricyclic antidepressant. So let's start. So as we have already discussed that the tricyclic antidepressant consists of all of these drugs like the amitriptyline, nortriptyline, protriptyline, clomipramine, imipramine, trimipramine, disipramine, amoxicillin, doxepin and rotipine. We have discussed that how to remember the drugs in the detail in the antidepressant classification. So kindly, if you haven't watched the antidepressant classification tutorial, kindly watch that video as well. And in this slide we will study and focus about some important points regarding some specific drugs. So the first drug is the imipramine. And the important point regarding the imipramine are that it is a prototypic drug. But it is much more cardiotoxic than the other fellow drug. It is a prototypic drug and it is much more cardiotoxic than the other fellow drugs. The other important point regarding the nortriptyline, the disipramine and the amoxicillin. The nortriptyline, disipramine and amoxicillin, and the point is that they are predominantly selective norepinephrine reuptake inhibitors, although they can also inhibit the reuptake of serotonin, but they are predominantly selective for the norepinephrine reuptake inhibitors, and it is characteristic of these three drugs, the nortriptyline, disipramine and amoxicillin. Now let's talk about the pharmacokinetics of the tricyclic antidepressants, and we will discuss the pharmacokinetics in the 4 headings, which can be remembered by the mnemonic ADMI. The first one is the A, and it stands for the administration. So they are well absorbed upon the oral administration. The second one is the D, and it stands for the distribution. Because of their lipophilic nature and structure, they are widely distributed throughout the body and they can readily penetrate into the CNS and can do its job of the antidepressant drug. The third one is the M, and it is metabolism. So their metabolism mainly by the hepatic microsomal enzyme system via the conjugation with glucuronic acid. They are metabolized by the hepatic microsomal system into inactive metabolites. And the last one is the E, and this E stands for the excretion, and they are excreted as the inactive metabolites formed by the hepatic microsomal enzyme, and this excretion is mainly through the kidney. Now, as we have already discussed the pharmacokinetics, let's talk about the pharmacological actions of these tricyclic antidepressants. So the first action is that it is a blocker of serotonin transporter. It blocks the uptake of serotonin into the neuron and thus enhance the availability of serotonin at the receptors in the CNS. You will see this in the figure in the coming slide. But for now, just remember that it is the serotonin transporter blocker. The second one, that it also blocks the norepinephrine transporter and thus enhance the availability of the norepinephrine at the receptor sites or in the synaptic cleft. The third effect is the muscarinic blockade. It has atropine-like action and thus it acts as a anti-muscarinic, and it will cause side effects like the dryness of the mouth, blurring of the vision, constipation. It can also precipitate the glaucoma, and it is by the mechanism that it dilates the pupil, and by dilating the pupil it will cause the pupillary blockage and thus prevent the outgoing of the aqueous humor into the anterior chamber, and thus it will prevent its absorption. Now the fourth effect is the alpha adrenergic blockade effect, and it will cause the side effect like the postural hypotension, tachycardia, and the cardiac arrhythmia. The fifth one is in the form of histamine receptor blockade, and it will cause the side effects like the sedation and confusion. The sixth effect is that it also lowers the seizure threshold, and it can precipitate the convulsions. Therefore, it is contraindicated in epileptics. So thus it is contraindicated in the glaucoma, and it is also contraindicated in the epileptics. The eighth effect is that it also causes the increase in the appetite, and it can lead to the weight gain. It can lead to the weight gain. Now these two effects, these two blockage are necessary for its antidepressant action. Now this is the picture showing the neuron. You can see the neuron. This is the synaptic cleft. All of this is the synaptic cleft. This is vesicles containing serotonin. Here you can see also serotonin in the synaptic cleft, and this is the serotonin transporter. Now what does this tricyclic antidepressants do? It blocks this serotonin transporter and prevent the entry of this serotonin back into the neuron, and thus there will be increase in the concentration of serotonin in the synaptic cleft. Here also you can see the autoreceptor. Now what is the function of this autoreceptor? We will discuss in the coming slide. Thus, in the same way, there will be increase in the norepinephrine concentration by blocking the norepinephrine transporter. Now you can see that the beneficial effects of the antidepressant starts after the 2 to 3 weeks, and it is because that increase in the serotonin concentration in the synaptic cleft. For example, this is one neuron, this is the second neuron, and here you can see the synaptic cleft. This is the synaptic cleft. So increase in the concentration of serotonin and norepinephrine in these synaptic clefts will do what? Serotonin will act on this autoreceptor. The norepinephrine will act on these alpha 2 autoreceptor. Now what does this autoreceptor do? That they give the signals to the cell there are much more concentration of serotonin and norepinephrine in the synaptic cleft, and stop releasing the norepinephrine and serotonin into synaptic clefts, and this will initially result in the decrease in the concentration of these neurotransmitter due to a negative feedback mechanism. This will cause initially decrease in the concentration of norepinephrine and serotonin in the synaptic cleft due to this negative feedback mechanism of the serotonin and the alpha 2 receptor. But later, due to desensitization of these receptors, the antidepressants effect will appear, and it is coincides with the desensitization of these receptors. When these receptors are desensitized, the antidepressant effects of the tricyclic antidepressant appears, and this is the mechanism by which the tricyclic antidepressant beneficial effects appear after 2 to 3 weeks, and before 2 to 3 weeks there is no or decrease in the effect of tricyclic antidepressant. Now the other adverse effect, some of the adverse effects were due to the adrenergic blockade, due to the muscarinic blockade, due to the histamine receptor blockade. Here is also some other adverse effect like the weight gain. It is common adverse effect of the tricyclic antidepressant because these tricyclic antidepressants, as I have earlier discussed, they increase the appetite. What do? They increase the appetite. The second adverse effect is in the form of sexual dysfunction, that it causes erectile dysfunction in the men and anorgasmia in the women. But these sexual dysfunction are much lower than the incidence of sexual dysfunction which are associated with the selective serotonin receptor inhibitors. So they are much less than the SSRI. Now come towards the uses of the tricyclic antidepressants. So the first one is the depression. They are used in the moderate to severe depression. The second one is they can be used to control bedwetting in the children, and the drug of choice for this is the imipramine. And they do by causing the contraction of the internal sphincter of the bladder. So by contracting the internal sphincter of the bladder, they are used to control the bedwetting in children which are older than the age of 6 years. They can also used for the migraine headache and the chronic pain syndromes like the neuropathic pain, and the drug of choice for this is the amitriptyline. They can also used for the insomnia, and the drug of choice is the low doses of the dexopin. So the first one is the moderate to severe depression. The second one is the bedwetting in the children. The third one is the migraine headache and the chronic pain, and the fourth one is the insomnia. So this was the lecture regarding the tricyclic antidepressant. So that's all for today. Thank you.